Hello, I'm Dr. Aditya from the Shoulder and Knee Clinic. Welcome back to our channel. So today we are going to discuss about frozen shoulder or adhesive capsulitis. What is this problem? How common is it? And what are the treatment options? What are the misconceptions around it? So you can see the video for further details. So if you look at frozen shoulder, it's probably one of the most common problems in the community about the shoulder for which people are aware. So if you see somebody having a shoulder pain coming to the shoulder OPD, majority of the times they will ask me whether they are having a frozen shoulder. My aunt also had it, my uncle also had it, and they were telling me that it could be frozen shoulder. Or a lot of times individuals will come who have seen general practitioner or a non-orthopedic surgeon, or for that matter a non-shoulder specialist, and they will tell that they had been diagnosed with a frozen shoulder and they have been taking these medicines and they are not yet improving. So what is this? Frozen shoulder essentially means a stiffness of the shoulder arising due to tightness of the joint lining in absence of any other identifiable cause. So actually, to tell that it's a frozen shoulder, you should have your MRI. There should be no other pathology in your shoulder like tendon inflammation or tendinitis or any rotator cuff tear. A lot of times what happens is there are no proper investigations conducted and every shoulder problem is labeled as frozen shoulder, which is not correct. Now, if you see what the typical frozen shoulder actually is it presents with a global loss of shoulder movement. So an individual will not be able to lift his hand in the front, rotate it on the side, or take it behind the back. What is frozen shoulder essentially is that there is inflammation around the shoulder joint lining, or the capsule as we call it. It leads to a shrinkage and tightness of the capsule, pain and restriction in movement. The loss of movement is in all directions. Accompanied with this, there is pain doing day-to-day activities and pain in the night while sleeping. There is generally no underlying pathology like a rotator cuff tear or any form of tendinitis. But a lot of these individuals have diabetes or they have hypothyroidism. So diabetes or hypothyroidism directly does not lead to a frozen shoulder. In diabetes or hypothyroidism, what happens is there are certain humoral mediators or chemicals which are produced in your blood which can lead to tightness or shrinkage of the shoulder joint lining, leading to stiffness and pain in the shoulder. So typically this frozen shoulder will be an individual who is between the age of 50 to 65, having pain and stiffness in the shoulder and underlying diabetes. So majority of these individuals would have seen multiple people and they are taking some sort of medicines and all that to treat the problem. So the most important thing we need to understand in management of this problem is there is no role for medicines. Medicines may give a temporary benefit with regards to daytime waking pain, but the night pain does not improve at all with the medicines. The medicines can help you in doing sessions of physiotherapy by decreasing the pain levels. So the mainstay of treatment for a frozen shoulder is physical therapy or physiotherapy. The physiotherapy will stretch your shoulder out, it will improve your shoulder movement, and that will give you pain relief. But the problem is, in a stiff shoulder, doing physiotherapy is very painful. So that is where the role of injections come in. So injections are generally intra-articular injections or injection in the joint. These are steroid injections. They will decrease the inflammation. They will help you do physiotherapy. Other than that, injection does not achieve any other purpose. So injection essentially is for pain control so that you are able to do exercises better. The movement is at the end of the day established with proper physiotherapy. What we do at the Shoulder and Knee Clinic is we encourage the individuals to do physiotherapy, and if it is very painful or if it's not feasible for them, now how many injections do you need? So typically we restrict ourselves to giving only one injection and asking the individual to do physiotherapy religiously, and I would say more than 95% of them don't need any further injections. Yes, an injection can be repeated. Let's say you have a recurrence of the problem after 3 to 6 months of an initial relief, then an injection can be given. There is no benefit of giving the injection in your shoulder if you have not had any relief even for 6 weeks. And that is where the final line of treatment for this problem comes. So, if despite injection or physiotherapy you are not improving, in that scenario we do a small surgical procedure or a keyhole surgery, in that the joint lining which has become tight, it is released, and we start with immediate aggressive physiotherapy to maintain your shoulder movement. So we get the full movement while doing the surgery, but the most important thing is to maintain that movement for first 6 to 8 weeks, and once you have done that, generally you should not have a recurrence of the problem. Frozen shoulder as such is a self-limiting problem. So once it is diagnosed, even if you don't do anything, it will take around 2 years to clear off, and you will get near complete movement in your shoulder after that. Studies have shown that there may be a movement loss of maybe around 10 degrees. The purpose of treatment is A, to hasten your recovery, because nobody likes to be in pain for 2 years, and B, to achieve the complete movement of your shoulder. So we go in a stepwise fashion while designing the treatment for an individual. What I would say is more than 95% of individuals will improve either with physical therapy or an injection in the shoulder. Very rarely do people need a surgical intervention for this. So the take home points is: 1, not every shoulder pain is a frozen shoulder. Frozen shoulder, although it's common in diabetics and people who have hypothyroidism, but it is not directly linked to that. Most important thing in treating a frozen shoulder is first to identify the problem correctly, if required doing an MRI to identify the problem, and then going ahead with the treatment. And the last and most important point, majority of individuals will improve with physiotherapy or injections in the shoulder. So thank you for watching. If you like our content, share and subscribe our channel.